My patient is a 53-year-old African American female. She works as a cashier at Family Dollar. She presents to the clinic alone and appears to be a reliable historian of her medical history. Her chief complaint: I have blood in my urine and pain in my abdomen. HPI. This is a 53-year-old African American female who reports seeing blood in her urine and has burning sensation when she urinates times 5 days. She has not had a menstrual period in 16 months with no breakthrough bleeding. She reports pain in her lower abdomen, which resolves when she urinates. She's married, is sexually active, does not use any form of birth control or condoms. She has never experienced any infections of her bladder and no prior experience of blood in her urine, and she denies frequency or odor. The location of her pain is in her lower abdomen. It's a recurrent ache, acute condition, 4 out of 10. Started 5 days ago. It has not worsened nor has it gotten better. Um, the discomfort lessens after urination, and she takes ibuprofen, which relieves the pain and discomfort for approximately 2 hours. Her past medical history: she's a generally well appearing woman. She reports 3 pregnancies with regular vaginal deliveries, no complications, no history of previous UTI, no diabetes, and no medications. No surgical history, no history of hospitalizations, no allergies to food, drugs, no environmental allergies, no allergies to latex. She's up to date on her immunizations and had a booster approximately 5 years ago, and she reports that she gets a flu shot every year. And she also gets her mammogram done yearly with no abnormal findings. Family history: her mother is 78, her father is 77, and they're both reported to be in good health. She does not have any siblings, and she has 2 children, ages 25 to 30, and she reports they're all in good health. She denies any family history of asthma, glaucoma, tuberculosis, diabetes, kidney disease, pulmonary disease, cancer, STIs, HIV, or AIDS. Urological problems: drug, alcohol abuse, family violence, epilepsy, congenital abnormalities, or psychiatric illness. She is a married cashier with a high school graduate. She lives with her husband and has 2 adult children that live out of the home. She enjoys gardening and walking. She reports being a Christian. She does not smoke, drink alcohol, or use illicit drugs. She exercises daily and has a varied diet to include fruits and vegetables. Um, she reports that her urinary symptoms have not interfered with her daily activities. Her review of symptoms: she denies fever, chills, nausea, vomiting, night sweats. She's had no unexplained weight loss or weight gain, no loss of appetite or difficulty sleeping. She denies loss of consciousness, no dizziness, no recent head trauma, no past head injury, no photophobia, no blurred vision, no edema, no redness to her eyes, her ears, no hearing loss, no sneezing, no allergies, no pain in her throat, no difficulty swallowing, no enlarged lymph nodes in her neck, no pain, no stiffness, no murmurs, no palpitations, no history of pneumonia, asthma. She reports lower abdominal pain that's intermittent, no hemorrhoids, no constipation, no rectal bleeding, no rectal pain. She reports urinary burning, hematuria, and abdominal pain for the past 5 days. She had her first period at age 13, and they've been normal. She's postmenopausal, has a sexual relationship with her husband. She denies stiffness, joint pain, or decreased range of motion. No history of depressive symptoms, no diabetes, no unusual bleeding or bruising, no fatigue, no seasonal allergies. Her vital signs were within normal limits. She is well nourished, well developed for her age. Her bowel sounds were positive in all 4 quadrants, no constipation. Her abdomen is soft, no distension, no tenderness, no vaginal discharge. Her skin turgor is good with no tenting. Her skin is warm and dry, no sweating, no rash or lesion. She's alert and oriented ×4, and her reactions are appropriate for her age. Differential diagnoses: urinary tract infection, vaginitis, and hematuria from a cause other than an infection. Vaginitis, she had no vaginal discharge, no vaginal tenderness, lesions, no history of sexually transmitted diseases, no vaginal itching, burning, no irritation with sexual intercourse. Her hematuria from causes other than infections, such as calculi, she had no suprapubic pain, no CVA tenderness, no flank pain to percussion. Her urine is yellow, no history of lupus, no history of kidney stones, no weight loss, no family history of nephritis, no fever, no palpable kidney mass, no tenderness, no vitamin use, no nosebleeds, and her diagnosis is a non-complicated urinary tract infection, blood in her urine, abdominal discomfort, and burning upon urination. Plan was a urine dipstick, which was positive. For leukocytes, the treatment is Bactrim 160 milligrams / 180 milligrams twice a day for 3 days. Education: educate her to complete her medication, even if her symptoms improve. Follow up if symptoms persist for 2 to 3 days. Perform good hand washing for infection control. Void after sexual intercourse. Increase fluids to at least 8 ounces, 8 to 10 glasses per day. Wear cotton underwear. Avoid harsh soaps or feminine products. Empty her bladder frequently and shower instead of taking baths.